Hello, this is Dr. Lee Nelson, and today we're going to look at how to administer blood. Okay, these are the supplies that you'll need to give a packed red blood cells to a patient. You see we have blood tubing, and this is designed specifically for the Alaris pump. We have normal saline. You can get a 250 cc bag, or like you see here, I have a 500 ml bag. I get gloves to protect myself, and I have already started the IV, so that's in the patient, but I do need to have a flush and alcohol wipe to make sure that it is still patent. Okay, what you see, I'm looking at the labs to see what his hemoglobin is, and his hemoglobin is 6.4, which is less than 7. I go to my orders, I double check that I have an order for give blood a unit of packed red blood cell for hemoglobin less than 7. And then what I also need to make sure is that I have a signed consent from the patient himself, which I do. Since we're going to be giving the patient blood, I inform the patient that we're going to be giving them some blood and give them some education as to what's going to happen. Remember, we do need to start with a set of vitals, a complete set of vitals, including temperature. We'll do that every after the first 15 minutes of blood, and then depending on the policy of your institution, at bare minimum at the very end of the transfusion. What we're doing here is flushing our IV line to determine patency, and I've already set up and flushed the blood tubing with normal saline. So we're going to be here in a moment after I determine the patency, hooking our normal saline line into our IV and run it at it to keep open. I've already primed my blood tubing with normal saline. I've hooked it into the Alaris pump, and we've programmed it for TKO. Now, at this particular institution I'm at, the TKO is 20 mLs per hour, and I double check everything. I double check, make sure it's correct normal saline, that it's programmed correctly, and there's no air in the line, and I check it all the way down to the IV to determine, to again assure it's patent. Next, what I need to do is call down to the blood bank to make sure that they have a unit ready for me of packed red blood cells. And if it's ready, then I ask them to go ahead and send it up right away. The blood bank has delivered the unit of blood to me, and I ask another colleague of mine, another RN, to double check the blood with me. There I start at the band and I give the name to her, the date of birth, and the medical record number, and she's double checking this on the blood and the blood sheet. She will then hand me the blood. Then we do the same thing. I say the name, date of birth, medical record number, the blood ID band number, and she's double verifying that this is in fact on her paperwork. I give the unit number, date of expiration, and that it is O negative, and she's double checking this on her paperwork as well. Once we have identified the patient, then we will sign the paperwork that it is in fact who he says he is, and it's the correct unit, and then also all of our vitals go on this sheet as well. Okay, what I'm doing now is I'm actually going to spike the unit of blood. First, I clamp off the normal saline, and then as you see, I'm spiking it right now. And then once I hang that, I will go ahead and open the blood side of the tubing, the clamp. Then now I'm going to change the rate of the pump to 999 with a volume of 25 mLs. That is for safety, and then this is to prime the line with the blood. In other words, I want the blood to get down to the saline log so we can start the 50 mLs per hour. Now, once the blood has arrived to the saline lock down to the patient, we're going to pause the pump, switch the rate to 50 mLs per hour. This will be for the next 15 minutes, and we'll place a volume of 13 mLs for safety, not to give more than that. And once we're done with that, we'll take a whole set of vitals and double check to make sure that the patient does not have any reaction to the blood itself. Once we're done with the 50 mLs per hour in the 15-minute time period, the patient has no reaction after we've done a full set of vials and we've assessed our patient. We will then change the volume to run the blood over 2 hours. So we'll change the rate to 125 an hour with a volume of 250 mLs. And that'll run over a 2-hour time period. Once our bag of blood or our packed red blood cells is complete, I will then clamp the side of the blood on the tubing, and I will open up the normal saline. The idea that I'm trying to do now is flush the tubing that has blood in it with normal saline. Now I'll put that at 125, maybe put a volume of about 50 on it at most, and then flush the line down. Once I've got all the blood into the patient, I will then stop the pump and I will flush the line. And then, of course, take another set of vitals per protocol.
Remember to always check your institution's policies for blood administration guidelines.
This is Dr. Lee Nelson again, and thank you for watching our video on how to administer packed red blood cells. We hope you enjoy it, and we'll see you next time. Bye.